Sometimes you get treated for a simple gynecological problem. Even though the doctor and the hospital worked to best of their belief, you do not feel happy. Why? We find the answer to such problems. Whether you are an educated woman or a junior doctor, learning new trends in medical science is absolutely important. If you do not know about personalized gynecology, it can seriously impact your future health care. Personalized gynecology is not just a term. Suppose you have a period problem, you have two options. One, get regular classical gynecological treatment, the treatment everyone gets. And the second option is modern personalized care, where you may be suitable for a tailor-made treatment that is just for you. This is just a tiny example. Not knowing about personalized gynecology means you will miss out on those treatment options. Today, we discuss the basics of new generation personalized medicine. After the invention of wheel, science probably did not make such a great revolutionary discovery. Personalized medicine has 4 steps. In English, they are called the 4 P's. Number 1, prediction and prevention of disease. Number 2, precise diagnosis. Number 3, targeted and personalized intervention. Number 4, more participatory role for the patient. But what the heck is that? Listen to find out. Let's use an example. How do you buy clothes? Many of us buy ready-made clothes from the store. Perhaps try the item in the trial room to check if it fits. Then you return home with the bill and the dress. Sometimes, upon returning home, the sleeves are too long, the collar is too short, a little tight around stomach. So the clothes we buy are often not the exact size for us. Many times, the purchased clothes and dresses need to be altered again. Or you may think you will wear it even if it is not exact fit. I will adjust. Such an attitude can be acceptable in fashion, but in modern medical science? No, never. What is the relation between buying clothes and modern medical science? There is a link. The concept of century-old medical science is just like buying ready-made dresses. There are several drugs and surgeries. Depending on which one could work for which patient, doctor used to prescribe them based on their educated guess. This is how the patient is treated. Sounds familiar? This is the traditional medicine treatment. But frequently, the treatment is unable to match patients' wants, needs, wishes, and priorities. Life is saved, but quality remains suboptimal. Gynecology focuses on women's health, including their emotions. Gynecology is all about emotions. Various expectations of her family and society are connected with her treatment. Women's health has 2 main expectations. One is universal, for all women. The suffering and pain during therapy should be minimized. I would like to return home soon. The bleeding should be minimized, and so on. These universal aspirations of several centuries have today been mixed with brand new additional aspect. What kind is that? Some time ago, hysterectomy used to be done to treat almost any period problems. Nowadays, women explore options such as hysteroscopy instead of undergoing major surgery. So, her problem is reduced, but she can avoid a major surgery. Nowadays, many women occupy most important positions at various levels in society or at office. Many are too busy at the work. If she takes a month off, her work may suffer a lot. So, she may demand that her treatment options be considered separately. Some have hobbies. She may love to climb mountains. In case of surgery, she will need a different stitch and some additional advice to stay healthy. They have to be operated in such a way that she can climb Nanda Devi again after a few months of surgery. One more example. This is tricky. A woman might say that she wants to be a mother even after having cancer in her uterus. Nowadays, science has reached to a point that it is possible to treat her and to give her a test of motherhood after gynecological cancer treatment simultaneously. Of course, in carefully selected cases. Let me mention a third example. The sexual orientation of some women these days has changed. Some may choose to identify herself as female or woman from the birth. Others may be genetically female but socially wanted to identify herself as male. In their cases, his gynecological problem has to be treated separately. On the whole, the liberty of physical health, emotions, and spirituality of individual needs to be respected in gynecology. Although these signs were dismissed with disdain earlier, today science has reached a state where the treatment of women can continue by respecting her needs and wishes. So, what do we find? Even if two women have a same gynecological problem, their treatments needs to be personalized and different from one person to another. Very different. And it is an art that both modern patients and modern doctors need to understand. Now, let's go a little deeper. Every patient has a different genetic profiles. Science is continuously gaining knowledge about diverse genetic profiles of individuals. Science is even learning which treatment work better for which women and on which genes. Cancer science has probably contributed the most in this regard, where we can learn exactly what type of treatment, such as which surgery, which chemo, or what targeted therapy will work for a given genetic mutation. You can check the mutation beforehand to check the need of the treatment. Next up is another unique aspect of modern medical science. Like any treatment, early detection is an important step in complex gynecology. Everyone knows, right? Until recently, all these diagnoses were symptom-based. Going to the doctor on the day when you are really unwell and down with symptoms. Although such symptom-based detection can still successfully treat many diseases, yet some will miss the chance of getting cured. This is because the disease has spread without symptoms. So today, science is walking on another road. It has reached or is reaching to a point where we are moving towards risk factor based diagnosis, where science detects if I have a faulty gene or have a family history of that disease. If I have, then doctor will not wait anymore for the symptoms. They will treat me before I develop any symptoms. The disease will disappear before even the symptoms appear. Amazing. Here is a real life example. If someone has got a family history of ovarian or breast cancer, their daughters or granddaughters are followed up completely differently so that the disease can be caught as soon as possible to give her a long life. After that invention of will, science probably did not make such a great revolutionary discovery. When people could read their genes in the body, they found that everyone in our body has some defect in the gene. This is called genetic mutation. We live with these flaws. Everyone has it. Let me give an example, an important example to show how it has transformed lives of women. One of the most notable genetic mutation is BRCA genetic mutation, a special mutation. If someone in the family has got this mutation, every descendant will have that genetic mutation in their body. This mutation will cause cancer. Boys will be more likely to develop lung cancer, prostate cancer, and women of that family will develop breast, ovarian, or uterine cancer. Do they die? Not at all. Here lies the success of the science. Cancer does not anymore mean the death is imminent. All these women and their family with BRCA oncogenetic mutation can be successfully treated and they can enjoy healthy, disease-free lives today. That's not all. There is more. Earlier, cancer was divided only by staging or grading. Looking under a microscope, as the staging increases, a more powerful and intricate treatment is necessary. Nowadays, the genetic profiling accompanies staging and grading. Take an example of uterine cancer. Stage 1 or early stage uterine cancer is further divided into 4 categories. The genetic profile of this cancer in the uterus determines who will need which treatment. If the genetic profile is such that we need more aggressive treatment, even in early stage disease, stronger treatment will be done. Without genetic studies, treatment may stay incomplete. In contrast, some genetic profile will suggest that lower intensity anti-cancer treatment is enough. Nowadays, frequently, genetic profiles are used to determine who will need chemotherapy or not. The goal of medical science is the same. We know diseases will stay as they are, but science will arrange modern treatments in such a way that after the disease is treated, the woman can live and live happily for many years with minimal side effect. Artificial intelligence has arrived. Human genetic profile contains millions of genetic mutations. AI will dictate how we will save ourselves despite having those genetic mutations. Soon, AI will be able to predict how chemicals from the surrounding environment, your own lifestyle, dietary habits will interact with millions of uncertain mutations. What will your future look like for you when you are 60? The doctor will be able to tell you about that in near future. The new chapter or treatment will open. But whatever it may be, the essence of all the discussions is the same. Diseases should be diagnosed rapidly. Health awareness is taking a big role in this. Only with awareness we will know how to prevent diseases, when to go to doctor and which doctor to go to. As you can see, there are 4 steps of personalized medicine now, just as I have mentioned before. First, prediction and prevention of disease. Precise diagnosis. If you know just the disease, how severe it is going to be, the treatment will be more successful and more life-oriented. Number 3, targeted and personalized intervention. And number 4, more participatory role for the patients, where the patient can decide for herself by judging good or bad, because she can see her future better if she knows the genetic mutation information. Today, science can predict based on patients' genetic profiles that which medicine will work for whom. Most of the medicines available in the market are not more than 60 to 70% effective. But future generations want more. If you look at the history, you will see our average life expectancy has increased from 25 to almost 80. Today, even with present generation, so-called less effective drugs. So you can well imagine the golden day when the medicine will become more powerful. The day quality of life will be enhanced by manyfold. The future seems to be really bright. That's all today. Have a good day. See you soon.